Ancient humans are usually imagined gritting their teeth through every injury, illness, and childbirth with nothing but willpower standing between them and unbearable pain. For most of history, that picture is wrong. Humans have been chemically fighting pain for almost as long as they have been human at all. Imagine breaking a bone, or giving birth, or being cut open for surgery, with no modern medicine anywhere in reach. Your options were not zero. They were strange, inconsistent, occasionally dangerous, and far more advanced than most people assume. Ancient humans were not just enduring pain. They were actively hunting for ways to switch it off. You would have been too. The oldest and most reliable weapon against pain grew wild out of the ground. The opium poppy was being cultivated in ancient Sumer as early as 5,000 years ago, and Sumerian tablets refer to it using a symbol that translates roughly to joy plant, a name that leaves very little room for interpretation. Opium dulled physical pain and mental anguish at the same time, which made it valuable for nearly every kind of suffering a person could experience, from battlefield wounds to the slow agony of terminal illness. The poppy did not stay in one place for long. Trade routes carried opium from Mesopotamia into Egypt, across the Mediterranean into Greece and Cyprus, and eventually along the same overland paths that would later carry silk and spices between Asia and Europe. Wherever it traveled, local healers adopted it quickly, because a substance that reliably reduced both physical pain and psychological distress needed no persuasion to spread. It sold itself, one relieved patient at a time, across thousands of miles and dozens of unrelated cultures that otherwise shared almost nothing else in common. Egypt inherited the poppy and expanded the pharmacy considerably. Medical papyri list dozens of plant-based remedies for pain, and one in particular deserves real credit. Willow bark, chewed directly or brewed into a bitter tea, contains a natural compound called salicin, which the body converts into the same active ingredient found in modern aspirin. Egyptian physicians did not know the chemistry. They knew the outcome. Chew the bark and the pain eased. That single observation, repeated for thousands of years across multiple civilizations, eventually became one of the most widely used medications on Earth. Egyptian medicine also used mandrake root, a plant with genuinely powerful sedative properties, along with cold compresses applied directly to injuries and swelling, understanding correctly, without any concept of inflammation science, that cold slowed the intensity of pain at the site of an injury. Physicians also prescribed honey dressings for wounds, which modern research has confirmed carries real antibacterial properties, meaning what looked like a comfort measure was quietly also preventing the kind of infection that made pain dramatically worse in the days following an injury. None of this required a theory of nerves or receptors. It required generations of careful observation and a willingness to keep trying. How many plants did ancient healers test before finding one that actually worked? How many failed or did nothing or made things worse before willow bark and mandrake root earned a permanent place in the medical toolkit? How many of those trials happened on a patient already suffering, with no guarantee the remedy would help at all? Greece formalized much of this knowledge into something closer to real medical practice. Hippocrates recommended willow bark specifically for pain and fever, building on centuries of Egyptian and Mesopotamian observation rather than starting from nothing. The physician Dioscorides, writing a few centuries later, described mandrake root being used specifically to numb patients before surgery, and the term he used for that numbing effect is the direct ancestor of the modern word anesthesia. The concept existed, named and documented, roughly 2,000 years before it became a formal medical specialty. Rome took the mandrake preparation further and turned it into something closer to a real surgical protocol. The physician Celsus, writing detailed surgical instructions, described soaking a sponge in a mixture of mandrake, opium, and other sedative plants, then holding it against a patient's face before an operation began, allowing them to breathe in the vapor until they lost consciousness or came close to it. This soporific sponge, as later writers called it, would be used for centuries after Rome itself collapsed, passed down through medieval surgical manuals as one of the only reliable ways to render a patient unconscious before a blade ever touched them. China developed one of the most genuinely advanced ancient approaches to pain, both mechanically and chemically. Acupuncture, inserting fine needles at specific points along the body, was used specifically to interrupt pain signals, and modern research has confirmed the technique can trigger the release of the body's own natural pain-relieving chemicals in certain contexts. This was not random superstition producing occasional lucky results. It was a systematic, repeatable technique refined over centuries of clinical observation, long before anyone could explain the underlying biology. The physician Hua Chuo, working around the 2nd century, is credited with developing a formula called mafacin, an anesthetic mixture believed to include wine combined with concentrated extracts from cannabis and other sedative plants. Patients reportedly lost sensation entirely, allowing Hua Chuo to perform abdominal surgery, a procedure that would have been unthinkable and instantly fatal from shock without some form of real pain suppression. Chinese medical texts describe this level of surgical intervention centuries before comparable techniques appear reliably anywhere else in the ancient world. India developed its own extensive pharmacy through Ayurvedic medicine, cataloging hundreds of plants specifically for their pain-relieving properties across an enormous range of ailments. Willow relatives, poppy preparations, and a range of local herbs were combined into formulas tailored to specific types of pain, from joint inflammation to surgical recovery. Ayurvedic surgical texts describe procedures including cataract removal and even reconstructive surgery performed using wine and herbal sedation to manage pain, techniques recorded in enough procedural detail that some historians consider Ayurvedic surgery among the most advanced in the ancient world. By the way, if you want the full extended series on how the human body has survived, adapted, and outsmarted its own limitations across history, with more detail and more sources than a single video can hold, there is a deeper breakdown linked in the description. New episodes added regularly. Link below. Now back to the pain. Across the Andes, healers relied on a plant that grew wild across the mountainside and doubled as both stimulant and anesthetic. Coca leaves, chewed slowly throughout the day, numbed the mouth and dulled minor pain on contact, and were applied more directly to open wounds during more serious procedures, including skull surgery performed on patients who, based on evidence of healed bone regrowth, survived the operation and lived for years afterward. An anesthetic growing wild on a mountainside allowed genuinely major surgery to happen with a real chance of survival, long before anyone in Europe would have believed it possible. Further north, Mesoamerican cultures including the Aztec and Maya maintained detailed botanical knowledge of pain-relieving and sedative plants, some used medically, and others woven into ritual practice for managing both physical and psychological suffering. Certain preparations were specifically reserved for warriors recovering from battle wounds, combining physical remedies with ceremonies meant to address pain as something more than a purely physical event, treating the mind and the injury as connected problems requiring connected solutions. Across parts of Africa, healers developed independent pharmacies built around locally available plants entirely disconnected from the trade routes linking Europe, Asia, and the Middle East. Kola nut, chewed for its stimulant properties, also carried mild pain-relieving effects and was used alongside other regional remedies for headache and fatigue. Traditional healers across the continent accumulated deep, orally transmitted knowledge of which local plants reduced fever, eased labor pain, or calmed inflamed wounds. Knowledge built independently and in parallel with everything happening in Egypt, Greece, and China, without any of these traditions ever directly meeting. Childbirth presented a different category of pain entirely, chronic, unavoidable, and impossible to simply cut around. Cultures across the world developed remedies specifically for labor, from herbal preparations believed to ease contractions to physical techniques like changing position, applying heat, and using rhythmic breathing patterns that modern medicine still recognizes as genuinely useful for pain management today. Midwives, almost always women, accumulated and passed down this knowledge for generations, entirely outside formal medical institutions that rarely acknowledged their expertise existed at all. That exclusion carried a real cost. In several documented cases across medieval and early modern Europe, midwives who used herbal pain relief during labor were viewed with suspicion by male-dominated medical and religious authorities, sometimes accused of witchcraft for the exact same plant knowledge a male physician might have used openly and been praised for. The remedy itself was never the problem. Who was allowed to administer it, and who was believed when they said it worked, quietly shaped which pain relief techniques survived in the historical record and which ones were suppressed along with the women who practiced them. Head pain received its own dramatic, sometimes disturbing treatment. Trepanation, cutting or drilling a hole directly into the skull, was performed across multiple unconnected ancient cultures, sometimes specifically to treat severe, persistent headaches or seizures believed to be caused by pressure or trapped spirits inside the head. Skulls recovered from Neolithic Europe show clear evidence of healed trepanation wounds, meaning patients survived a procedure that sounds, by any modern standard, closer to torture than treatment. Whatever pain relief was used during the procedure itself remains uncertain in many cases, which makes the survival rate even more remarkable. Some Neolithic skulls show not one but multiple healed trepanation holes on the same individual, evidence that the same person underwent the procedure more than once and lived through it every time. Whatever pain the surgery caused, it was apparently considered less severe, or at least more tolerable, than whatever affliction it was meant to relieve. A patient willing to return for a second skull surgery is not a patient who misunderstood the risk. It is a patient for whom the alternative was worse. Not every ancient pain treatment involved a plant or a blade. Ritual, chanting, and structured belief played a real and measurable role, and this is not a polite way of saying it was fake. Modern research into the placebo effect confirms that belief and expectation can trigger genuine, measurable changes in how the brain processes pain signals, releasing real chemical compounds in response to nothing more than expectation and context. A healer performing an elaborate ritual before treatment was not necessarily wasting time on superstition. In many documented cases, they were engaging a real biological pain response through belief alone, whether or not anyone involved understood the mechanism. Distraction itself functioned as a genuine tool, not an accident. Rhythmic drumming, chanting, and group presence during painful procedures kept a sufferer's attention divided, and divided attention measurably reduces how intensely pain registers in the brain, a finding modern pain clinics still rely on today with music, guided breathing, and structured distraction techniques. Ancient healers did not need to understand neuroscience to notice that a patient surrounded by chanting companions seemed to suffer less than one left completely alone. They simply kept doing what worked. Alcohol served as one of the most universal and least specialized painkillers available across nearly every ancient culture with access to fermentation. It did not target pain directly the way willow bark or opium did. It dulled the nervous system broadly, reduced panic, and made unbearable moments slightly more bearable, which for most of history was often the best realistic option available for sudden trauma, injury, or emergency surgery performed with no other preparation at all. Battlefield medicine pushed every one of these remedies to its absolute limit. Roman military surgeons carried wine, vinegar, and whatever plant-based sedatives were locally available directly onto campaign, treating sword wounds, arrow injuries, and amputations in field conditions with almost no time to prepare anything elaborate. Greek military physicians documented similar battlefield improvisation centuries earlier, using pressure, cauterization, and whatever numbing agent was on hand to keep a wounded soldier conscious enough to survive treatment without dying of shock in the process. Speed mattered more than comfort. A soldier bleeding out could not wait for a proper dose. He got wine, a leather strap to bite, and whatever the surgeon's hands could manage in the next 60 seconds. No time for ritual. No time for careful measurement. Just improvisation, repeated on battlefield after battlefield, refining itself through sheer necessity into some of the most practical trauma medicine the ancient world ever produced. Here is where the story reverses into something stranger than any ancient remedy. Long before opium, mandrake, or willow bark existed as tools, the human body had already built its own internal pharmacy, and it is still running inside you right now. The body naturally produces compounds called endorphins, chemicals that bind to the exact same receptors targeted by opioid drugs, and their release is not random. Severe injury, extreme stress, and even sustained physical exertion can trigger a genuine surge of these natural painkillers, a biological system called stress-induced analgesia. This is why soldiers have reported not noticing serious wounds until well after a battle ended, and why athletes can finish a race on an injury they only fully feel once they stop moving. The body was never simply enduring pain without help. It was quietly manufacturing its own relief the entire time, activated automatically at exactly the moment survival depended on ignoring the damage long enough to escape it. This system almost certainly kept early humans alive in situations no plant remedy could have reached in time. A hunter gored by an animal, miles from any camp, needed the ability to keep moving immediately, not after locating and preparing willow bark. Stress-induced analgesia would have activated instantly, chemically, without a single conscious decision required. Evolution had already solved the most urgent version of the problem millions of years before anyone thought to chew a poppy seed. Every plant-based remedy ancient humans ever discovered was, in a strange sense, borrowing from a system the body had already built first. Willow bark worked because it interrupted the same inflammatory pathways the body already regulates on its own. Opium worked because it activated receptors the body had already evolved to respond to its own internal chemistry. Humans were not inventing pain relief from nothing. They were finding external keys that happened to fit locks the body had been carrying inside itself the entire time. Not luck. Not coincidence. Convergent chemistry, discovered independently on every inhabited continent, because every human body was already running on the same underlying system. Compare all of this to a modern injury. You take a tablet, standardized, measured, tested for safety, purchased for a few coins at any pharmacy on any street corner. No mandrake root. No trepanation. No ritual chanting required to trigger belief-based relief, though the placebo effect still quietly works on you either way. Just a precisely measured dose of the same basic chemistry ancient humans spent thousands of years discovering one plant, one failure, and one desperate experiment at a time. You still carry the same emergency system every ancient human carried. The next time you twist an ankle and feel nothing until minutes later, that delay is not luck. It is the same stress-induced analgesia that once let a wounded hunter keep running, still installed, still working, completely unchanged since long before agriculture, writing, or medicine existed in any form. The story of pain relief was never really about the remedies themselves. It is about how consistently humans, across every disconnected civilization on Earth, refused to accept suffering as something that simply had to be tolerated. They chewed bark. They brewed poppies. They drilled skulls. They chanted, prayed, and drank themselves numb when nothing else was available. Eventually, they looked inward and discovered the body had been quietly solving part of the problem on its own the entire time, waiting patiently to be understood.